Backache. This is most common problem among acupuncture patients. So we have the table that shows the types of pain and treatment. Okay, let's start with heart pain. Worsens with activity, better with rest, severe radiating to the leg, eased by leaning forward, sitting or lying. If the pain is very localized, bleeding cup should be considered. So as you can see from the tower diagram, you could the yang of the urinary bladder is quite elevated. So we have to sedate the urinary bladder by using points bladder 65 and 60 or 63. We vibrate SI7, 4 local points with electrostimulation, bladder 37, 40, and 60. So another situation is where you have a subacute situation. Here you could see that the yin is deficient. Okay, so you have to sedate the bladder 63, vibrate SI7. We use kidney 4, the luo point, 4 local points with electrostimulation. Then we have bladder 37, 40, and 60. And the last one, you have a very chronic yin of the urinary bladder, yin deficiency of the urinary bladder. So you have, we have to use REN-free, bladder 40, kidney 7, 4 local points with electro stimulation, bladder 37 and 60. Now, cold pain worsens with rest, worse when sitting or lying, disturbed sleep, worse on bending, morning stiffness for a few minutes, better with warmth and movement, gradual onset and progressive. So the bladder yin is is in excess. Okay, so we need to sedate the urinary bladder using points bladder 63 or kidney 5. We vibrate kidney 5, 6 to 8 local hot needles, bladder 37. Next tower diagram, we have excess bladder yin with Yang Deficiency. We sedate bladder 63, sedate kidney 3, tonified urinary bladder 58, 6 to 8 local hot needles, bladder 37. And then we have deficient yang of the kidney of the bladder. So bladder yang deficiency. We use bladder 67, kidney 3, 6 to 8 local hot needles, bladder 37. Then we have damp pain. Worst at the beginning of movement from rest, morning stiffness lasting more than an hour. Both movement and pain improve as day goes on. Pressure, pain if sitting on the buttocks or thigh. So the first tower diagram, we have bladder yin excess or bladder, yin retention. Sedate the bladder using bladder 63, kidney 5, and we need to sedate the bladder yin. You're using bladder 63, kidney 5, vibrate kidney 5, 4 local hot needles and dry cupping, stomach 40. Then we have kidney, we have the bladder chi deficiency and bladder yin excess. Sedate bladder 63, sedate kidney 3. So this is very yin, tonify, bladder 58, hot needles and cupping, stomach 40. And finally, we have bladder chi deficiency, bladder 58, stomach 40, always yin stagnation, so luo points, local hot needles and cupping. So for wind pain, pain wandering between upper and lower back. If the lower back is better, then upper back hurts. If that is better, then the neck hurts, never without pain. So urinary bladder wind cold, few local points where it hurts on the day, bladder 12, GB31. Wind elimination, tonification, local moxa or hot needles. Urinary bladder wind heat, few local points with electrostimulation, bladder 12, GB31, wind elimination, sedation, SI7 vibration. Damp pain. There is yin excess in the chronic damp pain. This may not necessarily need yin sedation, but since it is a stagnation of fluid, it always needs to be circulated. Hence, the luo connecting point of the yang coupled meridian is used. This argument can be applied to damp cold pain, that is, a pain that is worse while resting and at the beginning of movement. Wind can be from exterior exposure or generated from the interior. If it is from exterior exposure, then the wind elimination points in the area applied with the wind elimination needle technique will suffice. If this is a chronic problem, it may be caused by interior wind. Liver generates interior wind, either in blood or yin deficiency situations. In blood deficiency, points REN13, bladder 15, bladder 17, GB39 can be used along with iron supplements. In yin deficiency, more likely in cases of wind heat, points liver 5, GB40 sedation, spleen 6 can be used to sedate the yang, which will ascend with the wind, and spleen 6 will descend the energy as a distal point of the lower warmer. Liver yin deficiency often goes together with kidney yin deficiency. This may be the reason that the back pain of wind heat manifests on the UB meridian. Tonifying kidney 7 would be useful. In the case of damp heat nature of pain, there can be two possibilities. So the first one, we have both yin and yang excess. This is an acute pain and has both damp and heat excess symptoms, such as pain during both activity and rest. Ideally, we should treat the causative factor and the reactive factor will reduce automatically. For instance, if the pain started after a fall or injury, the yang would have been the first to increase, but the pain would have increased the following day and it hurts now all the time. It would be enough to sedate the yang alone and the yin excess symptoms will be gone the following day. In osteoarthritis of the knee, the pain is often of a damp type, with edema and pain at the beginning of a movement. But if the patient walks excessively, it is possible that the knee will hurt more and become warm, and the character of the pain will change. Again, to sedate the yin of the meridian, give local needles, and cupping will work well in bringing down the inflammation. When it is not clear as to which energy increased initially, sedate both yin and yang. So the next tower diagram is a chronic state where both yin and yang are deficient and one cannot control the other, which means that sometimes one can increase and at another time the other can increase. The patient may manifest yang dominant pain if they walk or climb stairs and yin dominant pain when they sit or when the weather is wet, but not simultaneously. In this case, we need to tonify both yin and yang once a week and treat locally with electrical stimulation and dry cupping.